Hi, I'm Dr. Britton. Thank you for checking out West LA Neurokinesiology, where what we do is use a special kind of decompressive traction to be able to help relieve things that are symptoms of disc pain, back pain, sciatica, and multiple other things, degenerative disc. One of the reasons that this technique ends up helping so much is because we're able to make it personalized for you. Our staff, together with your help in our exam, allows us to be able to get this specific so that way when you're being treated, you know you have the best treatment possible, and we're able to explain what's going on and why you're getting better. This machine allows you, along with our staff, to be able to get better, no longer needing to go back and forth to your different therapists. We get everything done in-house. When you're on the decompression machine, it gently begins to open up, allowing your body to be stretched so that way the disc or the compressed or tight muscles down below are able to heal themselves naturally and without muss or fuss. Overall, the staff is very professional, and our main goal is to make sure that you get better without being hurt. When you get a chance, please come by, let us show us what we can do for you. Because for some people, it's not just about getting out of pain, but getting out of pain for a long time. Now, we don't just start off with the decompression and using the decompressive traction. We have a very special methodology to getting you fixed, and that's what you're about to see right now. After you've engaged in your decompressive traction, the next thing we end up doing is using class 4 high-powered laser. The main part of the laser is to help diminish the inflammation. There's research out there that says that using laser can decrease inflammation and speed up healing. Now, every single person on this planet's got a different body. Really, we won't know how much we need or how it'll work until you actually come in and we end up using it on you and giving you our best advice. Our main goal, again, is to get you better without drugs or surgery, being able to heal your body naturally. So after his decompression, he's getting his laser, and obviously, as you can see in this day and age, we're not even having to touch him, keeping him completely safe. One part of our state-of-the-art analysis is we end up doing a surface electromyograph. So that way we get an opportunity to be able to know what's going on at an electrical level in your spine. Electromyograph, one of the things that we're letting see is a stress test. So we can look at compensation versus the actual cause of the problem. What this young man's getting done right now really is a huge aid. It's like getting a palpation with electronic computer. And what we end up with when they're done is a nice graph that we can match against your x-rays or MRIs of the electrical activity going through your spine to your back and through your nerves. When you arrive, you'll be greeted with a warm and friendly smile.
Hi, Yuri. Welcome. Go ahead and sign in.
We'll use the latest of technology to make sure that we capture your information in a secure environment before you begin your exam and end up first meeting us and enjoying our team. We look forward to seeing you and getting you well. And again, be safe, be happy, and thanks for giving West LA Neurokinesiology a try. Okay, so now that we've gone over what happens on the outside of the body and how we treat it, one thing I want to show you is how degenerative disc or nerve compression can happen from your spine from a biomechanical nature. Again, if it happens from a biomechanical nature, it's not going to get fixed with just medication masking the symptoms. We're going to really have to get in there, and obviously we're hoping and we're committed to being your first stop before surgery. All right, so what we're looking at here is a spine that we have going on, and this person right here, there we go. We're going to just sort of tilt the camera just a tad bit. And what you're looking at is the spine here and how the lower part of the body and the muscles like the psoas and the iliacus interact with some of the nerves that are coming out. And what happens over time through wear or tear and damage to the spine itself, you actually get, there we go, let's angle that, this difficulty where all of a sudden as time wears on and you age, that the actual vertebrae start to compress because the discs are compressing. And so that aberrant stress pattern ends up compressing on the nerves. You see as they turn from yellow to red, right? They're irritated. They become inflamed from a biomechanical nature, not a virus, not a germ. And as that happens, it affects the actual function downstream. And as you can see, as normal wear and tear, the bones start to erode and start to change and become arthritic. That compression can lead to any one of these nerves being dysfunctional, and then the muscles or the organs that they reach to also. Then finally, as you go down the spine, we end up getting this problem with that the nerve or whatever's getting compressed down the spine end up also having problems. So we want to see that, and that's what we end up relieving when we put you on a decompression table and start to also do tissue work or laser, is using the decompression table to help open up these parts of the spine again so we can take the pressure off of it and get fluid back in. Now, we are not going to reverse the bone damage. That's why you want to get in as soon as you can before there's too much bony damage. I mean, unless you're going to go to surgery, which we don't do, this kind of damage can be long lasting and it'll be for the rest of life. So stop it as soon as possible. Now we have a neck and something similar. Text neck, looking down all the time, being on the computer, you see the spinal cord's going down as a big yellow line down, and then the nerve roots, as you lose posture, as the discs degenerate, they can compress right on those nerves. And now you see how all of these end up getting pinched. And for those of you with those tight necks that stay tight all the time, the symptoms that can come from that range all the way from, when you're looking at this, if this vertebrae is compressed at the C3, it's going to affect all the way to the top of the shoulders, part of the back of the arms. That's going to be affected down the hands, in the spine, down to the legs, or down all the way to the feet. So whether it's from diabetic neuropathy that's concurrent with your compressed discs, or it's just the compressed discs from injury over time, you can end up seeing that, hey, we're going to have problems here that aren't going to be solved by a medicine or an injection. So that's why what we're here to do is be able to increase the longevity of your body from a physical property, and using decompression techniques, using tissue techniques, using laser techniques. We're really trying to combine the best of all worlds, so you're getting treated just like you're a world-class athlete or some millionaire with billions in the bank, but we're making it affordable for you. So this is the end of the video. Please go ahead and get in touch with us, and we definitely answers questions over the phone. Just tell my assistant you'd like to set up a phone conversation with the doctor. Thank you and have a great day.